use for the male condom is higher. So we are hopeful that condom use for the female condom with time, with effort and promotion and education, it will also go up high. But right now we have a challenge of resources, and I think we are limited in the space. The mere fact that the government does not allocate money to support the condom program, even when you're planning to promote the condom, you do not know whether the supervisors really would approve what you're going to say. You're working on sheds. So, but would want to see the government come out, the policy leaders, members of parliament, support condom use, support condom education. We have a whole new generation of young people who missed out on the message that was early on spread by when there was so much HIV that it was very visible. But now condom education has gone down and condom use is going down. So it's a multiple challenges. The resources implement an effective condom program to make sure it reaches the last mile are limited.
4. We have female 1,424. Then male we have 876, taking us to a total of 2,300. Now based on this statistic, if just a small area like a constituency where I represent, it is carrying this big amount of people affected now against this one. That's why I'm drawing your attention. So, Director, there is a challenge down there because I'm always down to the grassroots. I always interact with these people using this health center. That's why I get the statistic. The problem they got down, especially the young children, the young children going to school, there is that thing of court legal issues concerning HIV. We find a neighbor taking an infected person to LC1 to handle the case in public, and this thing is affecting the two families because one may be on the process of playing, the other one get hurt by one of the kids who is positive, and is bringing really a big problem within the country. Condom is meant for urban people. It is normal. You go to a washroom, you just pick everywhere. You go and pick all corners you pick. But in the rural setting, that's why the increase of HIV is high, because in the first place they don't know how to use condom, and they fear that, you see that, and where to get access to condom within the rural areas, it is not there, let me say. So it is hard to get condom, and those people, it is not even being sold within the common trading centers. So we need to see the way of handling the urban and the rural area in terms of. Then last.
The Uganda Aids Commission, you give the kits for self-testing through the hospitals and the centers. And the Honorable Mwaka here is saying that some men can only instruct the girls to go. As a commission, as an agency, do you have a way of a follow-up? People get these self-cheats. What happens? Assume I've had the self-testing and I've discovered I'm HIV positive. What happens? What is the follow-up?
It is a hard one to a number of Ugandans, but when I refer to what happens now in the facilities, a pregnant woman has to go to the facility with the husband and both of them have to be tested. Why can't we make this happen in the facilities? Because even as we look at these statistics, I know we are missing a lot. There are people who have never tested since the time HIV entered in our country. I'm just passing it to us for a way forward. And now we are in 2024. The commitment is by 2030, we have 6 years to go. And now I see an aspect of stagnation, which is a very big challenge. I thought that the Uganda Aids Commission could have given us proposals. What are your proposals in this area, so that as a committee we will discuss on them to address this challenge of stagnation?